Hello, hello, hello. Welcome to Thursdays with Whitman-Walker. We have a special guest today, so come on in. Don't be shy. Happy Thursday, everyone. I hope everyone's having a great day. Happy Thursday. You guys know Thursdays I go live with Whitman-Walker. Today we have some Q&As with Dr. Hen about the COVID-19 vaccination. So, if you want to hear about some COVID-19 vaccination questions, stay tuned. We'll be talking to an expert from the Whitman-Walker Clinic today. So, good morning, good morning, good morning. Come on in. And don't be shy. Make sure if you have questions, we have our special Dr. Sarah Hen today with Whitman-Walker. We'll be talking about COVID-19 vaccinations, a couple Q&As. So stay tuned. Thursday's Talks with Whitman-Walker. Welcome, welcome, welcome. Come on in. We're just waiting for our guest. Good morning, good afternoon. All right, I think our guest is here. Questions about COVID-19 vaccine. We're going to be asking a specialist today. So come on in, come on in. Hello, Dr. Hen, how are you?
Hi, Laura. Good to see you.
Good to see you again as well. Thank you for joining us again.
Happy to do so.
Perfect, perfect. So I was just getting people informed on what's going on today. For those of you that don't know, I am Orlando, one of the social media influencers with Whitman-Walker. We've done a few lives with Dr. Sarah Hen. She is the Chief Medical Officer at Whitman-Walker about the COVID-19. So we're bringing her back today. She's going to answer a few questions from our viewers and a few questions that we have here for her related to COVID-19. Included the vaccine manufacturers, vaccination rates, CDC guidelines, and more. So anything you want to talk about, Dr. Hen is the Chief Medical Officer at Whitman-Walker, and she's worked with us since 2007. So she's board certified physician in both infectious diseases and internal medicine. Also holds a Master of Public Health degree. Would you like to introduce yourself today, please?
Yeah, I think you did a great job.
Sorry.
I was happy you didn't make me the Chief Communications Officer. I was afraid you were going down that path.
Oh, no.
But yeah, I'm a physician doctor at Whitman-Walker, and I'm excited to talk about the COVID vaccine tonight.
Perfect. So don't forget, everyone, we encourage you to ask questions. If you don't understand something we're talking about, please comment. We'll be checking the comments during our live today. We are going to start with the first question. So when we spoke last, COVID-19 cases, hospitalizations, and deaths were very high. Are they still high? And if not, what might have caused the decrease?
So I would say they are still high. I mean, we are making great progress. So, in January, we had days where there were 100,000 new cases in the United States. I mean, numbers hard to count. And so cases have gone down by almost 50% since then. But we're still at over 50,000 cases a day, which, that's still really high. So as a country, we're going in the right direction, but we still have work to do. And there have been some concerning signs in recent weeks with some states, including Maryland, with increased case numbers. And, certainly cases seem to be plateauing.
Okay, so let's see. I think someone asked, is COVID vaccine available for the public at Whitman-Walker now? Do you know?
So we do have vaccine. We're very excited to be vaccinating our patients. We are starting with our highest risk and oldest patients. And so we are reaching out proactively and giving people calls. We're pushing out messages to patients once they qualify. So we don't have enough vaccine yet for everyone, but we're certainly working on it. And we're encouraging people to also register with their state health departments.
Beautiful. So I mean, you already know Whitman-Walker is super efficient. So if they know you're a high risk, I'm sure they're going to reach out to you soon. So be patient and also go to your state website, like Dr. Hen said, and get registered, because they're telling me at work that they registered us already. bet. I'm also registered by my state just in case. I'm like, whoever comes first.
Absolutely. Register as many places as you can. I mean, if you work in DC and you live in Maryland, you can register in both places. So,
Oh, wow. Good to know. Good to know. All right. So let's see. The second question we have here. As of this live, just shy of 1 in 4 Americans has gotten vaccinated. Medical officials have said that we need anywhere from 70 to 90% of Americans vaccinated to reach a herd immunity, which would allow us to do away with COVID-19 restrictions. When might we expect to reach that herd immunity so that we can go back to normal?
I know we all dream of those days, right? Um, so I think, close to a quarter of the population, about 22% of individuals have gotten their first vaccine. So the number of people who are completely vaccinated, that percentage is still lower. It's about 12%. And certainly estimates range about how many people have had COVID in the United States, but it may well be upward of a third of the population has had COVID at that point. And so those people also probably have some partial immunity. Um, so at the current rate that we're vaccinating, I think, we have enough vaccine to really reach probably that 70% mark by mid to in July. So I think it's not that the vaccine won't be available. I think what our biggest concern right now is that people get it. Because when we're talking about getting 70 to 90% of the population vaccinated, we have to remember that right now, no one under 16 is eligible for the vaccine. So that means adults, we need a higher percentage than 70% of adults getting the vaccine to get to those herd immunity levels.
Wow. Yep, that's true. And the under 16, are they going to be able to get it after, or is that just they shouldn't be
So
getting it?
those studies are ongoing, right? So they started trials with 16 and above, and now both the Pfizer and Moderna are looking at 12 and older, and they're completing those trials. Those results will probably be out soon. And I heard actually just this week that they're starting 6-month to 12-year-old trials later this summer in the next month. So those studies are happening and they're happening quickly. So I think by the fall, we'll see the ages expanding who are eligible for the vaccine. But, little kids and babies probably need a different dose than us adults. So they're working to figure that out and make sure that we do it safely.
Wow. Okay, so the next question we have is the Johnson & Johnson COVID-19 vaccine was recently approved by the FDA, the third one to reach the market. How is that vaccine different than the ones produced by Pfizer and Moderna? Is it better, worse, or which one should people get at this point?
You should get whatever you can. Get
Right.
whatever. But let's talk a little bit about the vaccines. So all of the vaccines provide your body with instructions to make antibodies to the spike protein. And it's really how those instructions are delivered that's different. So the Pfizer and Moderna vaccines, which were the first to gain emergency use authorization, they're messenger RNA vaccines. So they have a little bit of a genetic code that goes into your cells and tells those cells how to make that spike protein to create antibodies. The Johnson & Johnson vaccine is a little different. It uses an adenovirus vector to deliver that genetic message to make that spike protein. And so that virus is an engineered kind of cold virus that's harmless. It won't give you the cold, but it enters your cells and then instructs them to make that spike protein so that you create antibodies against COVID. The big advantage of the adenovirus is that it doesn't have to be frozen. So it's going to be a much easier vaccine to get to places that are more distant or aren't a medical center, right? So it's going to be easier to set up vaccination sites with the Johnson & Johnson vaccine because it's just stored in a refrigerator. It doesn't have to be frozen. And it's just one dose, not two. In terms of how they work and how effective they are, all three are extremely effective in preventing hospitalization and death. I mean, all of them do a great job at this. It looks like perhaps people who get the Johnson & Johnson vaccine may still be slightly more likely to get a mild COVID infection even with the vaccination. So the vaccine looked like it's about 70% effective at completely preventing any type of illness. So that's a little bit less, but the advantage is it's one shot, you're done. And the big important thing is that all three do a great and equal job of keeping you out of the hospital. And that's really the most critical thing. None of us want to end up in the hospital really seriously ill.
Exactly. So I did see somebody asked about their eligibility. So send us a message in the Whitman-Walker box so we can get a little more information about your situation, and we can see about helping you find a place that would be suitable for you to get registered. All right. So Manager Deb, give us a little message in the DM at Whitman-Walker, and we can see how we can help. All right. So thank you. Thank you. Next question. Let's see. A lot of people distrust Johnson & Johnson because their products have harmed consumers in the past. Most notably, their asbestos contaminated talcum powder led to thousands of cases of cancer. How do you address those concerns, specifically for Johnson & Johnson, but also for distrust around the vaccine more generally?
Yeah. So I think the first, I mean, what happened with the talcum powder and Johnson Johnson is really, it's terrible, right? And none of us want to use a product that will put our health at risk. But I think first of all, it's really important to recognize that talcum powder and vaccines are undergo quite different scrutiny and are regulated. So talcum powder is regulated as a cosmetic, right? There's a much lower bar for a cosmetic in terms of proving safety than there is for a drug or a vaccine. So the Federal Drug Administration requires lots of, really thorough clinical trials to get a vaccine approved or even for the emergency use authorization. So the Johnson & Johnson vaccine, 58,000 people participated in the trial for Johnson & Johnson in, I believe, 8 countries around the world, 3 continents. So they really gathered a lot of safety and efficacy data for that vaccine. So I think that really should be reassuring. And for all of the vaccines, if you look at the clinical trials for Pfizer, Moderna, Johnson & Johnson, well over 120,000 people were in the initial studies. And so there is a lot of data about how safe they are and how effective they are.
Okay, good to know. So do we know exactly who is eligible to get the vaccine in DC, Maryland, or Virginia, and how can people sign up?
Right. So in DC, anyone who has a chronic health condition, and you can go on the DC website to see an entire list of chronic health conditions, but that includes obesity, heart disease, hypertension, asthma, COPD, HIV. All of those are chronic health conditions. Anyone with chronic health condition is eligible to sign up for the vaccine in the District of Columbia. Also, frontline healthcare workers, other frontline workers are also eligible. So teachers, childcare, other professions as well. So go online and register. There's certainly a lot more demand right now than there are doses, but get in line. They take into account your residency as well, what ward you live in. There are certain wards that are being prioritized because there has been more COVID infections in those wards, and so those wards are being allocated more doses of the vaccine. So yeah, a lot of people are eligible in DC. In Virginia and Maryland, the eligibility isn't quite as broad. They're still working on people who are older than 70, I believe, in Virginia still, 65 in Maryland. And then the next category will be people with chronic health conditions. So it's a little different depending on where you live. But like I said, you can register where you work and where you live. So take advantage of that as well.
I need to do that as well because I did it where I live and one of where I work, but I work everywhere. So I may need to go to another state and do that too.
Yeah, if you require to work in person, then you should be able to register where you work as well.
Okay. All right. So let's see. So the CDC recently came out with guidelines for what you can and can't do if you've been vaccinated. What did they recommend, and why can't I stop wearing a mask and social distancing if I have been fully vaccinated?
Yeah, I was so excited to see these guidelines because, I mean, one of the things we all really want and one of to be vaccinated is so that life can get back to normal, so that we can reopen, that we can see our friends, that we can go to restaurants, that we can go see live events and music and gather. And so these are the first recommendations really telling us what's safe to do. And so certainly it's safe for vaccinated people. So to be fully vaccinated, it has to be 2 weeks after your last dose of the vaccine. So, but if it's been more than 2 weeks since your last dose of the vaccine, you are considered fully vaccinated and you can gather indoors without masks with other people who are fully vaccinated. So, I had a small dinner party of friends who had all been vaccinated, and it felt really great and also really odd for the first time in a year. The other thing you can do is you can get together with another group of individuals. So if there is a family or, a household who is unvaccinated and they are all of low risk of disease and you're fully vaccinated, you can go visit them. You shouldn't pose any real risk to them of becoming ill. It's although it's possible, it's unlikely that you'd be carrying the virus symptomatically if you're fully vaccinated. And because they're low risk of getting the disease, you could get together with them. That being said, you can't get together with multiple families or households who've been unvaccinated because the risk does start to climb. And you still really want to wear a mask in public, and you want to wear a mask around anyone who's at high risk of disease and hasn't been vaccinated. So, but we're not having big parties yet, but we're still be able to gather in small groups. That's really exciting.
So I had a little question because I know, when I went to the doctor, he said I still had antibodies. So he said I should be okay with one shot. But how do we know when that one shot antibodies is like gone?
So it's that's a really interesting question, and you're on the cutting edge of science with that question there. So I think we do know that people who have been infected with COVID develop immunity, but that immunity wanes. So the recommendation is that if you have been infected with COVID, that you be vaccinated. Um, but we don't really yet know how quickly people's immunity wanes. And what we have seen is we've seen some people who get their first shot of the Moderna or Pfizer vaccine have more significant reactions, kind of like a lot of people get with the second shot. So more people get a reaction with the second shot as your body is mounting that immune response. And a lot of people who've had COVID before kind of have that mount that immune response really with the initial dose. And you kind of recognize that because maybe you have a low grade fever, you feel really achy, tired after that first dose. And most people don't experience that after the first dose, but often do after the second. And so, although we don't fully know, what I'm telling patients of mine is if they've had COVID infection and they get the first dose and they have a pretty significant vaccination response to that first dose, then they're probably fine and they don't need to get the second dose. But if you have that first dose and you don't really notice much, go ahead and get that second dose just to be safe, because we really don't fully know how quickly that immunity wanes.
Got it. Very good. Yeah, because they didn't really explain it. I'm like, well, how do they know? How do they know if they're looking for that second, the little paper they give you with that second option? Like, if it's not there, like, can they say, well, you're not fully vaccinated? How do they know that you?
They, I don't think we know what regulators are going to do. I know I heard just recently, like people are thinking about vaccination passports for travel, and I'm not sure what that's fully going to look like and whether or not 2 doses will be required. But I think it's fine to delay that second dose for now if you had a very significant reaction after that first dose, if you had COVID in the past.
Well, good to know. Let's see if there's any other questions. That's all I have for you today, but let me see if anyone mentioned anything. Well, it's always a pleasure to have you. I think you're the only person I've gone on live twice or three times with.
I know.
Well, let's see. Yeah, no one else has asked any questions. Someone said he will wait to get shots. The vaccine is a little suspect. People are still scared of it. But yeah, hey, however you feel, as long as you're being careful, Do what you must. Just make sure you check on your parents or check on your elders that aren't able to register so you can help them register and do it for them. Just try to get as many people who you might know not have options to look to get registered. If you don't feel like you're ready, that's fine. You're grown. Someone
Well,
said, how will
still going to encourage you to get that vaccine. So I'm going to say there are many reasons you should get vaccinated. 400 million people worldwide have had this vaccine. There have been no deaths linked to this vaccine. We have over 500,000 people who've lost their lives to COVID here in the United States. So absolutely. Are there things we don't know yet about the vaccines? How long immunity lasts? Yes. But do we know that they're safe, and do we know that they're effective in preventing COVID? Yes, we absolutely know that. There's been a small number of, anaphylactic reactions, but really a handful for these 400 million doses that have been given worldwide. So really, it prevents illness and hospitalization. So I really encourage you. It's how we're going to get our life back to normal. It's how we're going to get the economy back on track. It's how we're going to protect our family members and friends who are high risk. So, and then I did see another question go by. I'm going to take over your role for a second, Amanda. That
take
said,
over?
what if I didn't get a reaction? Did the vaccine still work? Yes, I think the vaccine still worked. I think, you know, some people, I didn't get much of a reaction. So I was joking, oh, yeah, I have an old immune system, but I think we all respond differently. And the vast majority of the evidence, these trials were done with people ranging in age from 16 to 80 plus, and across all ranges and all conditions with all comorbidities, they saw really similar efficacy for the vaccine. So I think you're still good. If you got both shots, I think you should feel reassured even if you get a reaction. And
Well, yes, good to know. So people, you heard it here from the doctor. So make sure, even if you think you don't need it or you're not ready, do your best to at least get registered, in case you never know what's going to go down with the government or like the world, that they're going to say, if you're not vaccinated, you're on lockdown. You can't come out of the house. You don't want to be on that list when they decide to like go full throttle and say everyone needs to be vaccinated, whether you want to or not. Like, don't be on that side of history, people. Well, we appreciate you. Thank you so much for answering our questions.
can I,
I'm going to finish
but
up giving them information, but you're good to go.
can I answer one more question I saw?
Sure, sure. Please, please.
And I will shut up. I think it's a good question.
No, keep talking.
Vaccines protect against all variants. What we know is the most common variant is the B.1.1.7. That's the variant that came out of the UK. It's thought to account for probably 30% or more of cases in the United States right now, and maybe why we're seeing cases level off, because it's more infectious. It looks like all three vaccines protect against the UK variant very well. There's been a little bit more concern of the other variants, but again, all the vaccines seem to protect against them, although they may lose some of their efficacy, but not. But they still seem to protect against hospitalization and death. And the J&J vaccine was actually tested in South Africa, and so people were in the trial who had those variants, and they seem to do well.
Perfect. Well, that's great to hear, because I hadn't heard anything about that variant regarding these vaccinations. So perfect. Good to hear. All right. So let's see. So you all know Whitman-Walker is still open for HIV and STI testing by appointment at our Liz location, Northwest. You watch the comments in case anybody else sneaks a question in there. At our Liz location, our MRC location, to make your appointments, it's 202-797-4439. And as always, social distancing is the way to reduce amounts of COVID-19 community transmission. It deliberately increases the physical space between people to avoid spreading the illness, especially around holidays where many people are used to traveling. Make sure you stay at least 6 feet away. Wear your mask in public. Avoid places with large crowds. Encourage from working from home if possible. Speaking with loved ones over the phone or FaceTime. Social distancing as caring for your community. Stay up to date on local, state, national guidelines for testing, quarantine, and vaccinations now, and general safety. Washing your hands for at least 20 seconds at a time, and stay home if you don't feel well. So don't forget to follow us on Twitter, Facebook, and Instagram, Whitman-Walker and Real Talk DC, to stay up to date with all of our Whitman-Walker topics. Thank you again, Doctor. You have a great day.
So have a good night.
Thank you. Take care, everyone. We'll see you soon.
Bye.